Now, the Texas system would be perfect, you know, if every industry worked like that. The problem is every industry in Texas doesn't work like that because, you know, because of the pharmaceutical industry, which is the greatest industry on planet Earth, And this is the issue with the pharmaceutical industry. And this is a common theme, an issue in all of America. The cost of buying or interacting with the pharmaceutical industry or the hospital industry or the health insurance industry, from what I've noticed, is very costly in America. It's such a costly affair to get sick in America. I'll tell you what, it's absolutely sad. Because in India, what happens is, if you take the number of doctors to the population ratio, and you compare that ratio with the United States has got more doctors per populace. You compare in India, it's a completely different case. I mean, we don't have enough doctors, actually, to tell you the truth. And yet somehow, the cost of our medicine, the cost of our healthcare is probably 10 times cheaper than America. And this is true even if you adjust that for currency rates. It's still so much cheaper than America. And that kind of bothers me. Because what that tells you is that the law of supply and demand is actually not working in America. It is working in India to a large extent, I would say. Now, I understand that private hospitals do charge a lot of money, and some of it is crazy, but some of it isn't. Healthcare is a very costly business, especially healthcare that is derived from science, Western science. It's very costly, and I hope people recognize that. But anyways, moving on. And this is the issue, right? The same health plan that applies to all of America applies to Texas. And this is the issue, right? No other cost is increasing. So the labor costs are also not increasing. Meaning people are kind of earning the same over and over again with slight increases, But health insurance costs are through the roof. People cannot afford proper healthcare in America, including Texas. And this is an issue. What this means is that if a laborer undergoes a health problem, because he doesn't work, he loses his job. And because the prices are so crazy, he does not have enough capital or money to actually treat himself. This is a tragedy of the Texas system. A lot of people are facing this. It's, I believe, one of the main reasons why Texas is becoming blue, more Democratic than Republican, because culturally, Texas is a pure Republican state. Economically, though, they're having second thoughts. They love the system they have, but they feel like because not every industry works this robustly, as I have mentioned, they feel like that's a huge issue. And I completely agree with the sentiment. If the federal government in the United States is able to bring controls in the healthcare and pharmaceutical industry, or, offer a public option, this is one of the biggest debates in America right now. People don't want to offer a public option. There are some people that want Medicare for all, meaning everybody is under the same system. I don't completely like that. I actually don't like that at all. There are some people that say only private, only private. That is not going to work. That is terrible because they've shown that they will have the behaviors of a monopoly. Unfortunately, this is just unfortunate, but this is how it works. But also very important, very interesting, I think, is the public option. And we have this in India. In India, what happens is the government runs hospitals, and the private sector runs hospitals. So we do have a public option, meaning I can get treated for free but I have to wait in line. There are a lot of administrative issues. I might not get the best possible treatment, but I might get the most affordable healthcare, which might end up being quality, but that's a hit and miss how much quality I get. And then there's a private industry where I'll get decent quality at very high costs. Sometimes, nominal costs, but most of the time very high costs. Now the quality can vary. Mostly the quality reflects the price. Sometimes the quality does not reflect the price because when you're dealing with health sciences, it's very unpredictable. People don't know everything about the human body, so adverse reactions can happen. This is the unfortunate reality of medical sciences. Nothing is set in stone. Yeah. But it's a huge issue, I think, in Texas, and the Texans are gonna have to solve this issue of healthcare. Hopefully they do, because it's a great model. But it does involve merit. To give you an idea, in India, a lot of people are asking for merit. Most of those people, when they get into a position of power, they do not give promotions based on merit. They look at caste. This is the reason why we have the quota system, and that's a completely different conversation. But I do think the way the merit system works in Texas is very, very, very commendable. They have created something so commendable. I mean, it's amazing. And I think this brings us to the conversation of what are the social benefits of living in Texas as opposed to living in California. That's the kicker, isn't it? Texas does not provide too much social benefits. California does a lot, but terrible administration has actually made it kind of worthless, unfortunately. What this does is that in California, you can get a lot of social benefits, but in Texas you don't get as much. While the income taxes in California are through the roof, Texas collects zero income tax. I'm going to say it again. Texas as a state, the federal government collects its income taxes. Texas as a state collects zero income tax. You know what? Dubai and Middle East countries are the only other people that don't collect income taxes. And that's amazing. Now let me tell you something. This is why the laborers in Texas don't have a problem with the merit system and an increase in salary that is slower than most other states. Because the government does not collect income taxes. So the Texas state collects taxes on sales and other things. It's not like they don't collect any taxes, but hey, they gotta build roads and everything, right? They don't collect any taxes, and that's frankly amazing. The health industry is ruining it, I guess. And that's unfortunate. It's sad. Texas is not a utopia. It's got many other problems, minuscule problems that can get conflated over time. But what a model for capitalism. You've gone from completely restrictive capitalism to completely free capitalism. I show you both spectrums. I do think the best is when both are mediocrity. The Congress government should get credit for this because they have tried to create a system that does everything in moderation. Unfortunately, our courts and judicial system haven't helped us in achieving the consumer protection that we hope for. Meaning, customer support is terrible in our country. And our country will improve over time. People start understanding that, not everybody, the system doesn't work if someone wins and another person loses. The system only wins when everybody wins or everybody loses. I think that's the power of the collective, I guess. When you are a society, this is how it works. And when we break down capitalist systems, I think it's very interesting. So, thank you for listening. Hopefully we can get some comments down there and get the conversation going. Thank you.